My name is Adam Highley. I am a pulmonary and critical care physician with Prisma Health. I graduated from the American University of Antigua, a college of medicine for my medical degree, did my residency in St. Louis with SSM St. Mary's, and now is part of a St. Louis University umbrella, and my fellowship was at Creighton University in pulmonary and critical care medicine. So a pulmonary and critical care specialist does two things. There's a lot of overlap between the two. However, on the critical care side, they take care of the sickest people in the hospital. They take care of the people who need the one-on-one care with the best, the best equipment, the best nurses, a lot of hands-on, a lot of intensive care. On the pulmonary side, we will take care of inpatient pulmonary consults, so patients who are having breathing issues, abnormals in their readings or abnormal findings in their chest x-ray, people who have cough, shortness of breath, you kind of name it. If it involves something with your breathing or in your chest, we're usually involved in the inpatient side. On the outpatient side, you might come and see a lung doctor for breathing difficulties, wheezing, coughing, shortness of breath, either at rest or exertion. And then in my area where I like to focus a lot of my time is diagnostic pulmonary medicine. So if you have a spot on your lung, if you have a lung nodule, if you have something that shouldn't be there, we look at it together. We decide, is this a big deal? Do we have to get a biopsy? Can we keep an eye on it? Is it nothing to really worry about? And outside of the chest and the pleura, where fluid can accumulate and other diseases can take hold, I focus my time there as well. I didn't originally think I wanted to do pulmonology when I was in medical school and then in residency. It was interesting, but I liked the critical care aspect. I liked the sick people. I liked the adrenaline rush. I liked the sickest people in the hospital, working with them, getting to know their families, and those disease processes are really unique. They're really individualized. But as time goes on and as you go through training in pulmonary critical care medicine, you really start to see the overlaps. You see how the lungs are affected when the patient doesn't even come in with a lung problem, how important breathing is, how important using a mechanical ventilator is to keep people alive, and understanding the mechanics and the physiology, really, they meld together really well. It's important to educate your patients because they just don't know what's going on. They don't understand the disease process. All they know is they don't feel well, they can't breathe, they're coughing. And for them to understand it helps them put a name, put a face to what's causing them problems. So we'll spend a lot of time sitting down, whether it's something they're doing, whether they're doing it on purpose or they're doing it by accident, or if it's a genetic cause, whatever it is, to help them understand it. Then that involves them in with the care as well. It involves them into following the care plan, taking medications, and working with their provider or myself. Sometimes patients come in and they have a very scary condition. They had an x-ray or a CAT scan and they found something and they heard a scary word like cancer. And I think not only is it my job to look at that and decide, are we going to do something with it? Is this a cancer? Is it something bad? But to also educate them and understand what these things can be and how it's going to be okay and how we're going to tackle this. So I think education is really core in people walking away with a good understanding of what we're doing and what's going on in their body. Free time, I have a wife and two girls, so they're very young. We spend a lot of time going out and trying to do a lot of family time, so that takes up a lot of time. I'm a little bit of a tech nerd on the side. I really enjoy 3D printing. The COVID pandemic got me into 3D printing, worrying about running out of things, ventilators, mask straps, face shields. We made a lot of those during COVID, and it's just kind of grown into a big hobby. So now I collect 3D printers and lasers and try to make things. My goal is to have enough tools to be able to make anything that I need in my home if I need it, and have it customized. We get a lot of patients who are referred from their primary care doctors because they need help in managing something, or they just want another set of eyes to look at this x-ray or to see why this patient is still short of breath. However, a lot of patients do self-refer as well. They know that I'm not breathing well, I'm coughing, I had a abnormal chest x-ray, I want a lung doctor to look at it. So we see patients both referred by their primary care providers, from the ER, from hospitalization stays, or on their own. If you're interested in making an appointment with me or seeing me, or if you have any concerns, call the number on the screen.